Maysam Yousif, Interventional Pediatric Cardiology. I will share my presentation now. COVID-related Kawasaki disease with persistent severe psoriatic-like skin manifestation and sudden cardiac death. A 16-month-old that previously healthy boy presented to our service, Sulaimani Hospital, in December 2023 following the recent family infection with COVID-19. The initial symptoms were high-grade fever up to 40 and cough, with two family members were admitted. Serology testing came positive for the SARS-CoV. During that, the first days of hospitalization, complaining from irritability and bilateral non-purulent conjunctivitis with erythematous rash on the trunk and extremities, swelling of the hand and feet with a cracked lip, a strawberry tongue appearance. Initial laboratory investigation show elevated inflammatory marker, high white blood cells, low lymphocyte with high platelet. Echocardiography showed that the normal function with no pericardial effusion and a mild dilated of left coronary artery about 3 millimeter with Z-score plus 2.5. On the day 10th, that it is the baby on 10th day of the disease, the patient deteriorated clinically with relapsing of high-grade fever above 39, developing that with respiratory symptoms, pneumonia patch on the chest X-ray that require transfers the baby to PICU for the cardiac and respiratory support. Inotropic support with milrinone 0.5 mic per kg per minute and nasal O2 1 liter per minute, as well as fluid management. Follow-up echocardiography showed that significant for multiple coronary aneurysm affected both right and left coronary segment. 10 millimeters Z-score above 6 and another one 12 millimeter above 8 as Z-score with that mild pericardial effusion. Standard treatment for the Kawasaki disease was initiated at 15 days from the onset of the fever with IVIG 2 gram per kg per day and the low dose of aspirin 5 milligram per kg per day with methylprednisolone 1 milligram per kg per day. During third weeks of that hospitalization, cardiac function had been improved, but severe skin manifestation developed with extensive dark erythematous eruption covered the face, trunk, and limbs, both upper and lower. Skin biopsy was done that the following interpretation that the derms dilation of the blood vessels in the upper derms and dermal papillae, lymphocyte infiltration around the vessels, epidermis that thickened with that extensive of epidermal ridge, hyperkeratosis with incomplete keratinization and that the mild neutrophil infiltration. These are non-specific change involvement that psoriasis like inflammatory reaction, vascular dilation, and lymphocyte infiltration around the vessel's wall. The dermatopathological report, it is part of the Kawasaki disease. During the 4th weeks of hospitalization, skin manifestation became more aggressive with that widespread psoriasis-like lesion and mucosal involvement, non-responsiveness for topical treatment and systemic steroid. The patient was maintained on methylprednisolone 2 mg per kg per day and low dose of aspirin 5 mg per kg per day with intravenous heparin, that presence of the giant coronary artery aneurysm. Sudden cardiac arrest with failure to resuscitation. After that, this case underscored that complexity of the diagnosis and the treatment of atypical Kawasaki disease in context of the concurrent COVID-19 infection. The initial presentation was complicated by severe cardiac involvement and later by persistent and severe dermatological manifestation. The Stevens-Johnson-like lesion and psoriatic-like eruption represent a rare condition with Kawasaki and may cause that severe complication in the Kawasaki disease. The severity of both Stevens-Johnson syndrome Toxic epidermal necrolysis and Kawasaki disease can be present with severe systemic symptoms including fever, rash, and mucocutaneous involvement, but their underlying mechanism and long-term implicated differ. Psoriasis with Kawasaki disease, there is limited literature direct connected between the psoriasis and Kawasaki, but both condition involvement significant immune dysregulation. Psoriasis is chronic autoimmune condition, while Kawasaki is acute vasculitis with suspicion of immune-mediated etiology. Both diseases feature a prominent role of cytokine in their pathogen. For example, TNF-alpha, which is central to the psoriasis pathogenesis and also been implicated to an inflammatory response in the Kawasaki disease. Thank you.